Hello everyone, today I'll be taking another VivaLive session on the subject of otolaryngology with the topic nose and the subtopic epistaxis. So let's start.
Welcome. Let's begin with the anatomy of the lateral wall of the nose. Can you describe the main features you would find there?
The blood supply of the lateral wall is from internal and external carotid arteries via sphenopalatine artery, ethmoidal artery and facial artery branches.
That's right. You've named the main arteries. Now consider this scenario. An elderly patient presents with sudden onset nasal bleeding and they are known to be hypertensive. What's the most common site for this bleeding to originate from?
The most common site for the bleeding to originate from is the Kieselbach's plexus or the Little's area.
Actually, in an elderly hypertensive patient, bleeding is more often from a posterior site, such as Woodruff's plexus. Little's area is the most common site for anterior epistaxis, usually in younger people. If direct pressure or cautery fails to stop the bleeding, what are the steps for anterior nasal packing?
For anterior nasal packing, if the pressure or cautery fails, we will put nasal sponges or petroleum jelly gauze or balloon catheters to provide continuous pressure.
Those are some of the methods, but the specific steps involve layering the gauze anteriorly, ensuring pressure against the bleeding points. Now, considering sinusitis, what are the general principles of medical versus surgical management?
I don't know. Can you please tell?
Medical management usually focuses on antibiotics, decongestants, and saline irrigation, while surgery is considered for chronic or complicated cases to improve drainage, often using endoscopic techniques. Moving on, what are some of the common causes of nasal polyps?
The common causes for nasal polyp growth are chronic inflammation like chronic rhinosinusitis. It is due to immune system response or can be due to underlying conditions like asthma, allergies, aspirin sensitivity, and cystic fibrosis.
Excellent. You've covered the major factors. Now, switching gears again, what about the etiology of a deviated nasal septum? What can cause that?
A deviated nasal septum can be caused by
Yes,
chronic.
congenital anomalies and trauma are the primary causes. For the final question, what are some potential complications of untreated sinusitis?
I don't know. Can you explain, please?
Untreated sinusitis can lead to complications such as orbital infections, meningitis, brain abscesses, or even chronic facial pain. Prompt treatment is important to prevent these issues. Well done on completing the examination. We've covered anatomy, epistaxis, sinusitis, and polyps. This information is not medical advice or diagnosis. Please see a healthcare professional or seek care for any health concerns.
Thank you.